Good evening, my name is Tariq Lewis, and tonight we'll be discussing a very important topic. The topic I aim to talk about tonight is how unsuccessful children and adolescent treatment facilities are, and to bring awareness to an increasing problem that many in the public are unaware of. I also aim to look at ways in which the successful treatment rates can be increased in these facilities. Now, this is a very in-depth topic. I only have 4 to 6 minutes to cover, but this will more than likely go more than the 4 to 6 minutes due to the depth of the discussion. We're going to be discussing 7 points throughout this speech. The first one, many children and adolescents with underlying mental health disabilities are placed in these treatment facilities programs which are specific for children and adolescents. These children are sometimes removed from homes where the parents and/or caregivers are unable to effectively raise and rear the children due to the children's extensive mental health disabilities. Secondly, these facilities are state-approved, state-funded, and accept state insurance, and most private insurances. They're actually behavioral health centers geared towards the successful treatment and rehabilitation of mental health disabilities for children and adolescents. Third, these facilities are marketed to consumers as being successful in treating patients and sustaining a sense of normality for these children in both the home and school environment. They promote themselves as being able to help young people develop trust, build self-esteem, character, develop, and become receptive to the intensive psychiatric treatment that they'll be put towards in these facilities. Fourth, through my personal experience as a paramedic over the last 19.5 years, I have witnessed the unhealthy environments that these children and adolescents are exposed to in these so-called successful treatment facilities. Sixth, what happens to the children and adolescents whom are unsuccessful in treatment at these facilities? And seventh, what can be done to improve the success rates of treatment for children and adolescents in these treatment facilities? Have you ever seen these group homes or ward of the state facilities, as they are sometimes called, with multiple people living in the homes, and wondered what these facilities are, what they specialize in, what their purpose is? Many people just don't know. I want you to understand that if you have a family member, a friend, a loved one, friend of a friend in one of these treatment facilities, I want you to know how you can help and what they are going through, and how subpar the living conditions are. I also want you to know how untrained the staff members are in dealing with these types of patients, and how underfunded these facilities are, and why their family member and or friend is not experiencing successful treatment in these facilities. Again, over the last 19.5 years, I have firsthand experience of transporting patients in and out of these facilities, seeing the environments they are exposed to. Many of the times these patients are repeat patients whom we have to take from these facilities to the hospital for detailed psychiatric treatment. They sometimes can be a harm to themselves. They can sometimes be a harm to others, the other patients that are in these facilities, and also the staff members. Many people with mental health disabilities are successfully treated and lead fully functional lives in society with continued therapy and appropriate medication management and follow-up. However, some of these people with mental health disabilities are unsuccessful in their treatment, and they are placed in these residential treatment facilities for care. They become wards of the state from childhood on through adulthood many times. Now, by recognizing that this is a major problem in our communities and coming together with proper community support and increased government assistance, the success rates of these treatment facilities can be increased, and more children and adolescents can become productive members of society and lead normal lives. We're also going to substantiate these statements by discussing the incompetence of the mental health facilities overall and shed light on how big of a problem this is. I will also show you how improving the mental health system will reduce overall costs associated with treating mental health patients and improve the success rates, allowing these children and adolescents to lead productive, fully functional lives in society. Now, let's take a closer look at the issue. We're going to look at what types of common disabilities and disorders there are, what are the long-term effects of these children being in these facilities, and again, what are the main health disabilities that we see on a frequent basis. So children and adolescents can develop schizophrenia, bipolar disorder, ADHD or attention deficit hyperactivity disorder, RAD, reactive attachment disorder, PTSD, post-traumatic stress disorder, anxiety disorder, emotional disorder, behavioral disorder, autism, and there are many others that we won't even get into. So according to Lou W. 2016, compared with children without mental disabilities, children with mental health disabilities have increased risk for developing chronic physical disorders, such as asthma, diabetes, epilepsy, which is seizures, or other comorbid health disabilities. For some children, mental disabilities can result in academic failure, violence, sexual risk-taking behaviors, substance abuse, and other risk-taking behaviors. Most seriously, the interplay of these mental disorders with other factors can lead to eventual suicide. Let's talk about schizophrenia first. It's a chronic and severe disorder that affects adolescents and children and adults between the ages of 16 and 30 usually. In rare cases, children can sometimes be diagnosed with schizophrenia. Symptoms are how a person thinks, how they feel, and how they behave. Sometimes it seems that patients with schizophrenia have lost touch with most aspects of reality. People with schizophrenia seem as though they can manifest as hallucinations, delusions, dysfunctional ways of thinking, agitated body movements, and reduced feelings of pleasure, reduced speaking, finishing problems, focusing. Schizophrenia can be genetic, or it can develop due to abnormal brain chemistry and or structure from birth. Treatment for schizophrenia includes antipsychotic drugs, special coordinated care with psychologists and case managers, and again, residential treatment facility placement. Next is bipolar disorder, also known as manic depressive. It is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out basic day-to-day tasks. One moment feeling up, the next moment feeling down. Feelings of sadness, depression, and hopelessness. There are 4 basic levels of bipolar that we're not going to get into for time constraints, but people with bipolar disorder experience periods of unusual and intense emotions. There are distinct periods called mood episodes. Extreme changes in energy, activity, sleep deprivation, all of these go hand in hand with bipolar. Treatment is inclusive, again, of medications, psychotherapy, which is talk therapy, which is what most psychologists do, and in severe cases, along with associated other mental health disabilities, residential treatment placement again. ADHD, or attention deficit hyperactivity disorder, is a brain disorder marked by ongoing patterns of inattentiveness, hyperactivity, impulsivity, and this again interferes with functioning, development, and day-to-day activities. There are different levels and subsets of ADHD from mild to severe. Causes of ADHD can be genetic, and generally in a family, when that first child has been diagnosed with ADHD, the preceding siblings will also have ADHD as well. Now, the causes of ADHD can be multiple. Drug use, alcohol use, cigarette use during the mother's pregnancy, exposure to toxins such as lead, low birth weight, brain injuries such as hypoxia or oxygen deprivation during birth. Now, treatments for ADHD, again, are inclusive of medication administration, psychotherapy, education and training for the caregivers, specifically to understand ways in which they can help a child to cope, such as note minimal changes in routine, talking to a child in a low voice, things of that nature. Now, RAD, or reactive attachment disorder, is a very rare disease process. It develops when a child does not receive appropriate and adequate comfort and nurturing from their parents or caregivers. An example would be if a child were to manifest, if a child was to be upset, they would rarely turn to the caregiver or the parent for comfort. Now, for support or protection. Now, when the caregiver does make sporadic efforts to comfort that child may seem aloof, not wanting to hug, not wanting to interact with that adult and or caregiver. Now, it is believed that children with RAD can develop specific forms of attachment to a caregiver and or adult. But again, this opens up these children to potential child abuse, sexual abuse, which happens in a lot of these cases. Now, there's no actual treatment for RAD. However, establishment of a routine, loving environment for a child is the best way to manage this disorder. PTSD is the next one, post-traumatic stress disorder. It develops in individuals who has experienced a shocking, scary, traumatic, horrific event. Now, we all feel scared from time to time and experience danger, but people with PTSD keep having flashbacks. They have anxiety. They have bad dreams, frightening thoughts. Now, if these events seem to proceed for a month or longer, this is when a patient is considered to be diagnosed with PTSD. Now, these patients also are easily startled. They have trouble sleeping. They have angry outbursts, things of this nature. Next, we're going to talk about anxiety disorder, and it is characterized by restlessness, fatigue, difficulty concentrating, irritability, sleep problems, muscle tension. There are genetic and environmental factors that cause this disorder, and again, treatments include medication and psychotherapy. Now, emotional and behavior disorders are characterized by the following: inability to build and maintain satisfactory relationships with peers, teachers, caregivers. They also have unreasonable fears associated with personal or school problems, hyperactivity, aggression, withdrawal, immaturity, and learning difficulties. Now, if we look at that, there seems to be a trend with many of these mental health disabilities. Again, the hyperactivity, the aggression, withdrawal, problems sleeping, problems engaging in normal interpersonal relationships. Now, this brings me to my second point. These facilities are state approved, state funded, and again, accept insurance. Now, residential treatment facilities are outpatient centers for people with multiple mental health illnesses that are incapable of being deemed competent to function in normal society. They are outpatient treatment facilities. Usually they're set up like a long-term nursing home with multiple halls and rooms on both sides of the halls. There are nursing stations set up strategically throughout the facility where staff can chart and observe the patients in their day-to-day activities. And some of them are actually homes that have been renovated to maintain more rooms, more living quarters for the patients that are in these home type environments. Now, these home type of environments are again set up to give that child and adolescents a sense of normalcy in their lives, just like a routine, normal, loving home environment. However, that's far from the case in many of these facilities. Now, let's look at how these facilities are marketed. They're marketed to consumers as being very successful in treating these patients and sustaining normality, again, of a home environment and school environment. They promote themselves as being able to develop people, develop trust, build self-esteem and character, and become receptive to the intents of treatment that they are given. I have witnessed violent outbursts by patients in these facilities. I've seen altercations between the patients, the patients themselves. I've seen altercations between the patients and the staff. And many times these frontline staff are just hired lay people off of the street. They have no formal medical training, no mental health professional training, such as certified nursing assistant. And generally there's only one main licensed staff on duty, such as an LPN or an RN. And the reason why for this is due to medication administration, patient assessment, things of that nature that the lay staff are not trained to do. Again, many of these facilities do not have set uniform policies for the staff. Many times we'll go in these facilities to start treatment of a patient, And many times you're unable to tell the staff from the actual patients because the staff are dressed just like the patients. They have no proper identification, no name tag. Like in a hospital setting, all nurses wear scrubs, doctors wear scrubs, all the staff in the hospital wear scrubs with name tags. Sometimes they wear certain colors to identify them as either doctors, respiratory therapists, physical therapists, things of that nature. But these facilities don't have any set uniform policies. Now, let's look at what happens to children and adolescents who remain in the mental health system and into adulthood due to unsuccessful treatment in these facilities as a child or adolescent. Now, just the other day, probably a week and a half ago, I transported a 60-plus-year-old female who stated that her case manager deemed her to be competent and to be released in society as a fully functional adult. Now, I actually saw her the day of her release. She was dressed in her finest clothes. Her family was helping her transition her belongings from the facility to the vehicle outside waiting for her. She had the biggest smile on her face, and I was so happy for her. I hadn't seen her that way in actually a long time. I'd actually taken care of this patient multiple times in the past. Now, for many of the adult patients that go on to continue to be unsuccessful in their treatment, they again become wards of the state. According to the National Advisory for Mental Health Council, success rates for treatments of a single mental health disability is between 60 and 80%. Now, you add into the fact that there's really no normalcy in these environments. Many of these patients have coexisting other mental health disabilities, so that percentage of successful treatment comes down substantially, and especially the longer they are subjected to being placed in residential treatment facilities. Now, let's look at some staggering statistics going into our final point of this discussion. What can we do to improve the success rates of these residential treatment facilities and return these people to a normalcy in their lives to become productive members of society? There's really no easy answer. Nobody in the field is really looking at a way to increase success rates. Things are going as they always have due to certain things, budgets, things of that nature. Now, everything in life takes financial backing. Mental health disease is no different. In fact, mental health disease appears to be on the incline rather than the decline in society today. According to the National Alliance of Mental Health, as of September 21st of 2016, 1 in 5 children between the ages of 13 and 18 have a mental health disability. 20% of youth between the ages of 13 and 18 have a mental health disability. 11% have a mood disorder. 8% of youth have an anxiety disorder. The most common mental health illness in adolescents is anxiety, mood, attention, and behavioral disorders. Adolescents with mental health illnesses often engage in risk-taking behavior, acting out behavior, such as substance use, unsafe sexual behavior that may result in pregnancy or STDs. Now, 50% of all lifetime cases of mental health illness develop by age 14, and 70% develop by age 24. The age delay between the onset of symptoms and intervention can be as long as 8 to 10 years. So imagine there are patients out there fully functional in society who have not yet been diagnosed with a mental health disorder because of complacency, neglect, the stigma that can be attached. They're afraid of the stigma that can be attached with diagnosis of these health disabilities. Now, 37% of students with a mental health condition between the age of 14 and older drop out of school. This is the highest dropout rate from any disability. 70% of youth in the state and local juvenile system have a mental health disorder. Suicide is the third leading cause of death in youth ages 10 to 24. In fact, this last school year, one of the students aged 15 committed suicide by hanging himself in our community. Who knows what that child was dealing with? He might have had mental health disability. He might have been undiagnosed yet. But these are some of the actual real-life events that happen in society. Now, 1 in 5 adults in America experience a mental health disorder. Nearly 1 in 5 or 10 million adults in America live with a serious mental health disorder. One half of all chronic mental health disorder begins by age 14, and again 3/4 by age 24. Now, 1 in 100 adults, or 2.4 million, have schizophrenia. 2.6%, or 6.1 million, of American adults have bipolar. 6.9%, or 16 million, of American adults live with major depression. 18.1%, or 42 million, of American adults live with anxiety disorders. And approximately 10.2 million adults have co-occurring mental health and addiction disorders. Approximately 26% of homeless adults staying in shelters live with serious mental health disorders. And again, I believe that statistic is low because many of these patients, again, have been diagnosed, have not been in follow-up treatment, cannot get medications. So, like I said, that statistic is actually probably higher. Approximately 24% of state prisoners have a recent history of a mental health disease, and depression is the leading cause of disability worldwide. Mental health illness costs Americans billions of dollars annually. In fact, specifically 193.2 billion annually. And 90% of those whom died by suicide had an underlying mental health disorder. Many children, adolescents, and adults go undiagnosed due to self-denial from patients, family, self, and the medical system. The first step is to recognize that there may be an issue that needs to be addressed by a medical professional or a physician. Now, a physician can refer patients to the appropriate medical professional for evaluation. I believe that the most important aspects of successful mental health rehabilitation is that loving support from family, friends, and loved ones. That support many times is non-existent in these mental health disorders because the family does not want to accept that. No one wants to be diagnosed with a mental health disease due to that stigma that's attached with mental health disease. Furthermore, increased government assistance needs to be allocated towards mental health disease treatment facilities. And health systems need to do a better job of operating that mental health component of their health system, and they need to allocate increased budgets and training for the mental health departments. Mental health training needs to be instituted for all employees who are in care for patients with mental health disorders. Now, many times employees who work at these residential treatment centers, like I said, have no formal training, let alone neither do they understand any of these mental health disorders. Treating patients with mental health disabilities is unlike caring for any general medical patient or nursing home patient. Mental health is actually a subspecialty, just like cardiology, just like respiratory, pulmonology, etc. Now, this brings me to my conclusion. Mental health disorders are a large disability for all age demographics in America. The cost associated with treating mental health illnesses of all age demographics is overwhelming. Remember, we spend $193.2 billion annually just in treatment and care for mental health disease. Now, if we fail to address this issue correctly and promptly over time, it will only get worse. Like I said, mental health disease is on the incline. This largely exists because we fail to educate ourselves as a community and as a health professionals, and we don't understand how far-reaching these diseases are. At the heart of Christianity is the fact that we should be caring for people. Having a heart that cares shows that we are seeking to be just like Jesus. Jesus showed compassion for others. It was easy to see not only in meeting the spiritual needs of people, but he clearly showed compassion for their physical needs. He often healed the sick, gave comfort to the poor, and provided for the physical nourishment and needs of thousands, as was evident by many of his miracles performed. Here's the call to action. Love freely, give freely. If you have a youth, a loved one whom suffers from any mental health disorder, that you need to show them tender love and tender care and genuine love. 1 Corinthians, the 13th chapter, verses 4 through 8 states, love is patient, love is kind. Love does not envy, is not boastful, is not conceited, does not act improperly. It is not selfish, not provoked, and does not keep a record of wrongs. Love finds no joy in unrighteousness, but rejoices in the truth. It bears all things, endures all things. Love never ends. Now, I admonish you to understand mental health disorders. You might become the light of life for someone suffering from a mental health disorder. Love conquers all. Thank you for your time and attention tonight.